Hi everyone, my name is Ani and I'm going to be presenting my project, Predicting the Unpredictable, Artificial Intelligence and the Difficult Airway. So the healthcare problem that I'm going to be speaking about is airway assessment. As anesthesia providers, one of the most fundamental things that we do is assessing a patient's airway. And we do this because determining whether a patient may be at risk for a difficult airway can help prepare and avoid life-threatening complications. Early recognition of a difficult airway allows anesthesia providers to modify airway management plans and utilize specialized equipment or techniques to avoid complications such as failed intubation or failed ventilation. So, standard practice for anesthesia providers is to use multiple predictive factors to determine the risk of a difficult airway. These include demographic information, past medical, surgical, or anesthetic history, if available, and physical examination findings. The problem with these physical exam findings is that they tend to be biased and there's a lot of user variability. Um, and not every provider will be doing the same physical exam every single time. An emerging technique for airway assessment in terms of technology is ultrasound. And while ultrasound has been helpful in determining airway assessment, it does have um, barriers which include inter-rater reliability, and unfortunately, it is time consuming and is an additional cost for facilities. The solution that I came up with is an AI assisted pre-op airway assessment tool designed to standardize the process. And this process includes taking photographs of a patient from the front and from the side, both neutral and with maximum mouth opening. And these images would be put into a computer program that's trained to um, determine whether a patient has a difficult airway through machine learning. This tool seems to be emerging as I found information both in the literature and on ChatGPT. So AI models have been developed to identify facial landmarks commonly used in airway assessments, including the eyes, thyromental distance, thyroid notch, forehead, tragus, and radix, which demonstrated highly accurate and stable predictions in airway assessment. And when I spoke to ChatGPT about my solution, it also identified that AI and machine learning have been starting to be used in determining whether patients can have difficult airways. So, a few impacts that this AI technology would have. Financially, the initial cost would be pretty substantial because it would include developing the software and the machine learning, integrating that into the EHR, training the staff, and making sure that all of this information is protected, encrypted, protected, and kept safe because it would have pictures of people's faces incorporated into their EHR. However, to offset this initial cost, there would be many benefits into incorporating this, which would be a better workflow and productivity because now this airway assessment process is standardized. So there would not be so much user variability. It would just be taking the pictures and putting it into the machine learning. And patient care would be greatly improved because there would be less life-threatening complications and emergencies, which are associated with great healthcare costs. Before this AI model is introduced into practice, a few issues that would have to be addressed are ethical issues. And this is because AI models are trained on limited or heterogeneous data sets and populations. And this could potentially lead to inaccurate predictions and lead to some healthcare disparities. So we would have to ensure that the machine learning encompasses different ethnicities, patients with different BMIs, and patients who are different genders. Privacy wise, like I mentioned, data insecurity needs to be addressed because we'll be having patient photographs and information in the EHR. And we'll have to make sure that these photographs are encrypted and that the machine learning tool is encrypted as well. Overall, the aim of this is to improve patient quality and safety. So by using this tool, anesthesia providers will be able to predict difficult airways more readily and manage these airways appropriately. Thanks for watching. And here are some of my references if you want to learn more about AI and machine learning for difficult airways.